So, hello everyone, and this is going to be our Q&A with Dr. Omar Maniya. You can go ahead and introduce yourself.
Hi, I'm Omar Maniya. I am a fourth-year emergency medicine resident in Mount Sinai Hospital in New York City.
All right, our first question is going to be in this category of schooling, and it is, can you tell us more about your undergraduate journey and how you got into medical school?
Yeah, so I went to Georgetown undergrad in Washington, D.C. Both my parents were doctors, and so I was exposed to medicine from a young age, and I thought it was really interesting. And so going in, I majored in biology, and I knew I wanted to be pre-med. And it was interesting looking back. You do a lot of science in medical school, and so I kind of wish maybe I had majored in something other than biology in undergrad, but at least I was able to take a lot of elective classes and experience some other areas. And then I stayed on at Georgetown for medical school. There was Georgetown, and I think many schools have a direct early admissions pathway. And so I applied my sophomore year to medical school and was accepted. And so then junior, senior year were lower stress. And then I started medical school there. I took time off between third and fourth year of medical school to go to business school. And so I went up to Harvard Business School and did an MBA. And then I came back and did my last year of medical school before coming to residency. So sort of a like ping-pongy type of path. And I'm happy to talk about that more if you'd like.
All right. And then our next question is going to be, how hard was it for you on your journey to becoming a doctor? And what's a piece of advice that you would give to people that want to pursue a similar path?
How hard was it? So I think when everyone thinks about how hard it is, they think about like the getting in part, which is certainly competitive and getting, at least it's perceived to be getting more competitive over time as more people are interested. But and of course that part is hard, but I think what I realized is actually doing it is the harder part, because applying, you do it once and then you're done. But actually going through medical school is, it's not a joke. And so, the first years of medical school are pretty rigorous and intense. And it's basically like college with triple the amount of classes, and you're studying, pretty much every weekend. And so that was obviously challenging. But then when you start to get into the hospital, third and fourth year of medical school, and of course residency, it just becomes so much more fun. Yes, the hours get worse, but if you really want to be a doctor, that's where the real fun happens because you're treating patients. So was it hard? Yeah, absolutely. And it probably gets a little hard before it gets better in terms of first years of med school, but then it gets a lot better.
All right, and then we have a third question, which is, at any point in the schooling you had, did you feel like giving up?
That's a really good question. I don't think I ever felt like giving up, but I did question why I was doing it at different times. I kind of alluded to how the first 2 years were really tough. Particularly second year of med school was like a very grueling time for me. It's just like you've been doing this for so long. You're now 6 years into like formal schooling after high school. And there's, it just keeps getting harder and harder in terms of like workload. You're just like, our second year was structured, so we had a big test every 2 weeks. And so like you finish one, you get like 2 or 3 days to relax, and then you're right back into it. That's when I questioned, like, is this really what I want to do? But I don't think I ever seriously considered giving up or dropping out.
All right, and then what advice do you have for students who are planning on attending medical school in the future?
Yeah, I think my biggest piece of advice is before you commit to doing it, try to figure out if that's what you really want to do. Now, I talk to a lot of students who say they want to help people, and that's great and that's important. but there are a lot of ways to help people. I think the better question is, do you want to help people and specifically by being a doctor? And, I think it's sometimes sort of taboo to like ask that question, but I think it's really important to ask yourself. And that might involve shadowing, that might involve talking to people who are in medicine already. But I think it's really important to figure out, like, would I be happy waking up every day doing that job, as opposed to I'm doing this because of momentum and because of people around me and because of societal expectations or whatnot.
All right, that's some great advice. Our next question is, what factors do you think play the biggest part in your chances of being accepted into medical school?
Yeah, so I mean, I should caveat this with I only actually applied to one medical school because of the early assurance process, but I've seen my peers and colleagues apply to many schools and have advised a bunch of students. So I kind of seen it through a bunch of different lenses. Obviously, standardized test scores, namely MCAT, matter a lot. Obviously, GPA matters a lot. And, there's much smarter people than I who have documented the actual data around that. But I think the part that is sometimes overlooked is like who you are as a person. And what I mean by that is not just like, oh, I did 5 extracurriculars and I'm buffing my resume. What I mean by that is like, what do you fit into the culture and the type of the med school that you're applying to? And so I've seen people who have get interviews from the top places and get acceptances there, and then get rejected from all of the other places they applied, and vice versa. And I think a lot of it comes down to fit. And so some medical schools are trying to train primary care docs for their local region. And if that's your fit, that's perfect for you. And other places, probably won't accept you. And vice versa. If you want to go to a big research institution and that's your fit, that's great. But then that place I just talked about that wants to train primary care doctors for the local area probably is going to accept you. And I think, there's oftentimes a tendency to think of all med schools are created equal. And each of them has their, unique twist. And I think aligning your application to that unique twist can be really helpful.
Yeah, that's some great insight into that. And it kind of flows into our next question, which is about different schooling locations and stuff. So this next one is, I live in Minnesota, and it is likely that I attend the University of Minnesota for my undergrad and hopefully medical school. However, I don't know if I see myself working and living in Minnesota after my schooling. How much of an influence does medical school location have on residency opportunities and their locations? By attending a Minnesota school, am I binding myself to Minnesota and or the Midwest in general?
Yeah, I think each specialty is pretty different. And so I can speak to emergency medicine specifically, and I think it might be analogous to others, but I'm not 100% sure. And no, the answer is no. You can certainly break out of your local region and your state when applying to residency. I think you might have to go an extra mile though. And what I mean by that is in emergency medicine, you have to do a few away rotations. And so if you're coming from Minnesota and you want to come to New York City, for example, doing away rotation in New York City to show commitment, to test out that region, to meet the key players in that region, I think is important, both from a signaling effect that, hey, you took the risk to come here and have kind of shown that you're interested in this space, as well as making the network is really important. And I think that's probably true for most specialties that require away rotations. I think it might be different for specialties that don't require away rotations. So most of the surgical subspecialties will have them, emergency medicine does. Other specialties like family medicine or internal medicine usually don't require an away rotation rather. But you can still do them. And so I think my answer, from my understanding, is that you can absolutely break out of and leave the state or the region for residency, but it might take a little extra effort in terms of away rotations to get there.
All right. And then our last question for this section about schooling is, I am almost certain that I want to pursue medicine and become a doctor. However, I'm not sure where I want to attend school. Is there much of an advantage to attending a highly prestigious school, such as the Ivies or Stanford or like the different top-rated schools, rather than a state university when we're pretty sure that the end goal is medical school and residency? Is the higher difficulty in academics and higher competition for research and volunteer opportunities at more prestigious schools an upside at all?
That's a fantastic question. I'm sure if you ask 100 people, you probably get 100 different answers. My view of this comes down to something I mentioned earlier, which is fit. You know, if I don't think it's like I don't think it's like law school or like other industries where top 10, top 15 has a dramatically different career opportunities than the rest of the pack. I just don't think that's true. I think it comes down to fit and where you thrive. And so if you are, I think if you're really into research, yeah, go to a place where you'll have research opportunities. If you are really into a particular subspecialty that doesn't exist at the school you're going to, that's probably going to make it more challenging. For example, in emergency medicine, there are a lot more, there's a cohort of medical schools that don't have an emergency medicine residency. And so that makes it, you know, a little bit more difficult for those students to get mentorship and to get exposure, etc. And so I think it really comes down to fit. I don't think that the vast majority of people, quote unquote, prestige of medical school dictates their residency and, more importantly, their career outcomes. I just don't think that's true.
All right, thank you so much for answering and giving insight to those questions about schooling for becoming a doctor.